Good afternoon to our listeners from FMPH 40. This is Behrad Hafezi from Larson News coming at you with a prime-time investigative report this afternoon. Today's topic will be coronary heart disease. Isn't that right, Emily?
Yes, I'm Emily with this afternoon's report on the number one cause of death in the United States, coronary heart disease, aka CHD. CHD is when plaque buildup of cholesterol, fat, calcium, and other substances obstruct blood flow in the large arteries, causing the heart to be deficient in oxygen-rich blood and ultimately placing immense strain on the heart. This disease currently affects an alarming 18.2 million Americans, with many not showing symptoms until they exhibit chest pain, have a heart attack, or go into cardiac arrest. The prevalence of CHD and its possibly lethal consequences demonstrate why we need to be aware and informed about this disease. In fact, CHD is a leading cause of death for both genders, though men tend to be more affected than women, with 21.6% of male deaths stemming from CHD compared to 19.5% in women. Across race and ethnicity, the percent of deaths attributed to CHD are highest in non-Hispanic whites at 21.3%, followed by Native Hawaiian/Pacific Islanders at 20.8%. Yet, despite these shocking statistics in the United States, CHD is a global issue, with rates highest in areas like Africa, Eastern Europe, the Middle East, and parts of Asia. Risk factors for CHD include smoking, high cholesterol and high blood pressure, genetics, people older in age, obesity, physical inactivity, and more. However, many of these are preventable behaviors, so engaging in alternative habits may make all the difference in your heart health. All right, now we'll have Behrad to discuss the current state of affairs with coronary heart disease.
Thank you for the great information, Emily. To add on to that, I'm going to touch on the policies surrounding coronary heart disease. The CDC researches the policies and interventions for heart disease, and they have a group called the Applied Research and Evaluation Branch, which uses the data they get from their research to make better policies. Then, another branch from the CDC called the Applied Research and Translation Team methodically deduces which policies are the best for targeting heart disease. This means that on a federal level, the CDC provides guidelines and data for states and communities to use to make effective policies and intervention strategies. According to the CDC, current prevention guidelines include anything that reduces out-of-pocket costs for patients with high blood pressure and cholesterol, team-based blood pressure control, eating healthy, physical activity, and quitting smoking. There are a multitude of screening tests done for coronary heart disease as there are multiple risk factors. These tests include blood pressure, cholesterol, BMI, blood glucose, and waist circumference. Diagnostic tests such as the EKG are given at the physician's approval. I will now pass it on to Kaela to expand more on the sources of information.
Thanks, Brad. This is Kaela giving you the full report on where to get information and treatment for coronary heart disease. Other than the common healthcare problem of asymmetry of information between providers and patients, coronary heart disease is very accessible to the public. More specifically, the CDC, the Centers for Disease Control and Prevention, has very informal and concise fact sheets regarding diseases, and luckily enough, it has a page catered to coronary heart disease. I do want to advise everyone to be diligent with the information you obtain. Before I talk about access and seeking care, I want to address some misconceptions. So first misconception, if it runs in the family, there's nothing that can be done to stop it. Although your risk is higher than those without family ties, it doesn't mean it is certain you will get it. There are ways to reduce the risk. Adhering to healthy lifestyle choices can definitely help overcome the risk. The second misconception is taking statins, a cholesterol-lowering drug, can allow you to eat whatever you want. When it comes to diet, statin only rules out the unwanted effect of poor diet. Therefore, disrupting your diet can help to increase other risk factors for coronary heart disease, such as obesity and diabetes. The third misconception is heart disease affects only older people. Yes, people age 65 and older are at higher risk, but 1 in every 5 heart attacks happen in someone 40 years or younger. This type of heart disease, like any other, comes early and develops over time. Therefore, what you are doing now can greatly impact your risk for developing heart disease. To get more information and access to resources about coronary heart disease, I highly recommend visiting your local hospital or clinic and speaking with your medical healthcare provider. Also, please make sure to attend regular checkups and take your prescribed medicines. Use the internet wisely and always fact check with your doctor. To follow up, we'll return to Brad for an explanation on possible treatments of coronary heart disease.
Thanks, Kaela. Treatment for coronary heart disease includes medications such as beta blockers, aspirin, and cholesterol reducers, amongst many more. There are also surgeries that can be done to correct a blocked artery. With all this being said, this condition is not curable. Overall, the measures taken so far have been very effective, as we've seen a large decline in heart disease mortality over the last few decades. Regardless, we hope to see a cure for this condition in the near future. Thank you.